invite Dr. Salim Mulla, LRB Ayurvedic Medical College, India, to give his presentation titled Efficacy of virechana in vitiligo. Hello, Dr. Salim.
I'm very thankful to organizers, Scientex, for giving me opportunity to deliver this speech. So my topic is on Ayurveda-based therapy. That is a virechana. We call it as Panchakarma in Ayurveda. So I will explain in further slides. I myself, Dr. Salim Mulla, working as a professor at LRP Ayurvedic College, Islampur. I am also doing private practice at the same place and at Sangli, nearby from the Islampur. Okay, so I will go to next slide. Can you have the option to forward the slides? Do organizers have the option to forward the slide?
Okay, just a second.
Okay. So I will explain abstract in very short time because time is limited. So this is a single blind randomized clinical study on patients of vitiligo. In Ayurveda, we call it as a Shvitra. Shvitra Kushta, that is a one form of the Kushta rog, or we broadly call as the leprosy. That is another disease, but for the similarity, it has taken the word. So in Ayurveda, that is a Shodhan Chikitsa, that is a purification treatment, is the base for this treatment. So there are different types of Shodhana Chikitsa. So out of these treatments, one treatment, that is a virechana, we call it as a therapeutic purgation for that. So that was done with the virechana drug, that is virechana yoga. So the main content of the drug was the Abhayadi Modak. I will explain the contents of this drug in next slides. So as per Ayurveda text, the pre-procedures, that is a foliation, and that is a steam giving, that is a Swedan, we call it as. So these pre-treatments are given to the patients. So with these treatments, the regular internal medications that may contain different drug formulas for the livers and the skin treatments, and some local application with the sun exposure. So the rays that contain the UV radiation, we call it as the Atapa 7. So that is given as the phototherapy to each patient. So total duration of treatments we tried is the 6 months. As per the severity, some patients may require less time, and some patients may require somewhat more time. So so the response to the treatment we observed as the reduction in the area of the depigmentation after the treatment. So we got the good result in 56.6 cases, moderate result in 33% patients, and mild relief, that is a 10% cases. So we studied it statistically. The result is highly significant at 1% level. So we observed not many or major side effects in the patients. So we have tried different types of vitiligo patients, say for example, having different that is the age, different sexes, and different that is with associated diseases. So different patients we have tried. I will explain in next slide. So I will give some basics about this. So vitiligo is quite a I think it's a somewhat challenge to the medical fraternity. Not easy for the treatment, doesn't respond to routine treatment. In allopathic treatment of science, I think to my knowledge, no 100% cure is available for this. So for the patient, it creates very bad social stigma. Although in most of the patients, practically we don't find any serious systemic abnormality, but it may have. In Ayurveda, we call it as a Kshvitra. Other alternatives are the Kilas and Daru. So in some patients, we got some associated pathology like hypothyroidism, diabetes mellitus, or some liver problems. So in Ayurveda, it is described that it has the same causative factors as per the leprosy, because Ayurveda considered is as a type of the leprosy, Kushta, we call it as. So it is what is the difference between the leprosy and this? It is without the discharge. In leprosy, we got the discharge as the prime. So it is without a discharge, and as per Ayurvedic science, it is vitiated with 3 doshas, that is the Vata, Pitta, and Kapha. So again, it is associated with the dhatus that we call as the building tissues of the body. So we consider here as a rakta, that is the blood, mouse, that is a muscle tissue, and lipid, that is a meda, we call it as lipid tissues. So it is associated with this type of tissues. As per our ancient Acharya Charak, he has described some special causes, that is a telling lie, not believing in the God, not apologizing someone's good deeds, performing sins, deeds of the previous life, we call it as a purva karma. So these causes point towards the inheriting nature of the disease. So we call it as a 26% inherited type of, 25 to 26% as an inheritary type of the disease. So these causes may at some level point towards this inheritary nature of the disease. In Ayurveda, one more cause has been described that we call it as a pradnyaparad. So pradnyaparad, that is means that the improper decisions taken by the brain. Say for example, taking the unnecessary food, or taking some adulterated food, or that is doing some acts that are not healthy at all. So this type of behavior, we call it as a pradnyaparad. So unbalanced diet again is a major important cause. Unbalanced, that means we call it as viruddha ahara. That means making some hot, mixing the hot and cold substances. Say for example, milk and fruits. Fruits are considered generally as a hot substances, or the mixing of the fish and milk. So this type of diet in Ayurveda is considered as a viruddha ahara. So it disturbs the basic digestion, and it produces somewhat toxicity in our digestive process. So that in turn, because the digestive juice is the nutrient of the skin, in Ayurveda, this is the basic. So proper digestive juice formation, clear juice formation, proper digestion 100%, that is a no residual or the no very much disturbing material there, inflammatory material with the digestion. Say for example, if we eat spicy, so much of this that is inflammatory material is produced, and that is called in Ayurveda as a ama. So that is a main for the rasadhatu dushti, and that in turn that is a makes the skin ailments. So in leprosy, it is different from the leprosy. So it is in the views that it is a non-contagious. It is a non-contagious, non-bacterial, and it also doesn't destroy the body tissues, and it doesn't has the discharge. So vitiligo generally occupies the skin, blood, muscle tissue, and the fat. Otherwise, the kushta, that is a leprosy, goes deeper tissues also. Here, in short, the treatment in Ayurveda is always holistic. So generally, there is imbalance of the regulating hormones for the melanin synthesis. So for the balance or the homeostasis of these doshas and the hormones, we conduct the body purification treatment, that is a panchakarma. So we got the very good results doing the panchakarma on the skin patients and some associated problems. So we describe it as a very powerful treatment in Ayurveda, and Ayurveda advises that doing these type of treatments before the start of the other treatment is always helpful, because eradicating doshas, vitiated doshas from the body is always helpful, and it lowers the disease power. So Ayurveda Panchakarma is a first line treatment in most of the serious diseases. So as we do earliest panchakarmas or the purification, it brings about the equilibrium very early. So it increases response to other treatment. So this is a Sanskrit Siddhanta that supports these views. So dosha kadachit kupyanti jita langana pachani hai jita samshadane re na tesha punarudbhava. That means the recurrence is also lowered with this type of purification treatment, and it is better than the regular day-to-day treatment because it eradicates the doshas or the causes. Okay, so we'll go forward. So it is a better treatment. There are 5 types of Shodhan treatment, purification treatment available. That is a Vaman for that is a eradicating dosha, kapha dosha from the mouth. Purgation, that is a virechana, eradicating pitta dosha per anal route, and the Basti treatment, that is it is for balance of the vata dosha. Then bloodletting treatment, we call it as a rakta mokshan, and nasya, that is for the diseases of the that is a nose, ear, and eyes, etc. It is described. So along with these internal medications, this is a line of treatment for the vitiligo in Ayurveda. So along with these internal medications and local application, we call it as a lepa chikitsa. So that also supported by UV sunrays exposure, possibly morning, early morning. So that contains the UV rays. Treatment is generally long term, and it may have to continue for months to years. So this is some modern view. I will go very fast through this. So it is called as leukoderma. There is a relative absence of the melanocytes for the melanocytes in the melanin in the melanocytes. So there are 20% cases autoimmune, 26% are hereditary. So diabetes mellitus is also associated in subject. So there is a treatment that is a diagnosis of vitiligo. It generally assessed by skin biopsy. Some genes are associated with it on the chromosome number 70. Okay, so I will go faster. This is a study design, inclusion criteria. So patient fit for the panchakarma are selected for this study, and the patients both are included with or without history of the vitiligo. Some exclusions are there, so I will skip this. Then that is the mode of administration is important. Patients were given the virechana treatment after the Purva Karma, that is a Snehan and Svedan and steam bath. As per the text, virechana was given in the early morning, and we observe or we expect 8 to 12, that is the speeds or the vegas of the virechana were allowed for the proper procedure. And to stop virechana, we use the hot water for the drinking. Virechana was followed by some special rules of the diet and living. We call it as a Samsarjan Krama, and some that is a rejuvenative treatment. We call it as a Rasana Chikitsa as per the text. So this is a formula for the virechana drug we use. That is Abhayadi Modak. The main contents are the Haritaki, Manishunti, Vidang, Amlaki, Pipali, Twaka, Mustaka, Patra, and Danti. So major is the Danti and Trivrutta. Okay, we call it as Nishottar, that is a operculina to terpentan. So this is a main content. It has the that is a natural purgative action. So it is a powerful purgative. So these some drugs are the soft purgatives, some drugs are the powerful purgatives. There are combinations that as per the expected action. So it contains the Trivrutta. It has a natural purgation action, that is a virechana prabhav, and that is a drug. Other drugs like Pipali are Pittarechak. Marich is a Pramati. Pramati, that means it has the tendency to bring the doshas in the excretory tracts, and it removes from that. Okay, so that is, it has the natural tendency for that. So this is a mode of action. So tatra samshodhanam ajnayanam dravyanam vidivat upayogaha. That means most of the drugs contain Abhyadi Modak are Ushna, that means hot. Tikshna, that means again how the that is a hot nature, and these are adobhagar purgative. That adobhagar means that they have the purgative nature. Hence, it facilitates the virechana due to pitta virechana. So textual dose is described with very large. Practically, we use just 1 to 2 tablets. That means the 250 to 500 milligrams of the abhyadi moda. So these are the some signs of the proper panchakarma we follow here. That is some getting the lightedness into the body. That is limiting the self-limiting. That is a purgation urges or the vegas. Then feeling of the lightedness. Then satisfied mind and body functions. Relief of the symptoms most important. The duration of the treatment is for this practical treatment. The virechana treatment is 6 days. Follow-up we done as monthly intervals for 3 months. So these are some observations we take at the that is a basic as the 0% and the full result as the 100%. Then we that is obtain the difference between the results and which calculated statistically according to these data. So these are the some. Here one point I want to mention. So here are the results we have tabulated. So we have done the graphical representation of this. So these are the some statistical calculations. So I will describe the observations that we observed the t-value in these calculations as 19.54 times the standard error. So probability was probability is less than the 0.001. So it is highly significant at 1% level. So results are due to the intervention, not natural. With the intervention done with the virechana, so that is responsible for this variation. So these are the summary of the these discussions. In later slides, the important pictures, that is before and after treatments of the real patients, I will show in some slides. Time is very limited. I will finish in short. So observations can be summarized as follows. The positive factors like unbalanced opposite nature diet, that is a viruddhahar, is the main in these patients. Some patients eat very much rice, some patients eat very much, that is a milk contents. So again, a consumption of the excess milk, rice and other non-vegetarian food. So say for example, chicken. So it is considered as the major causative as per the Ayurveda Siddhanta or therapies. So that is the Ayurveda principle. The most patients, in most patients, we doesn't get the exact cause. Then history of taking allopathic medicines with the steroids is noted in significant number of the cases. Early cure was noted in. I think steroids have no role in this in the treatment of this disease. They use I think as an anti-inflammatory or the other that is a principle, I don't know. So history of taking allopathic medicines including steroids is noted in significant number of cases. Early cure was noted in patients with short duration of the disease. That means if the patient has very short history of the disease, the cure is very fast. So in most of the patients, the signs of the proper virechana we noted. So no major side effects of the treatment were observed. In fact, we got the very good improvement in the digestion process. We got very good improvement in the excretory process. We got very improvement in the that is a fat deposition. So weights are again controlled, and some minor infections like fever or the RTIs are very rarely noticed in these patients during this long-term treatment. So no recurrence after the stoppage of the treatment. So the patients who take the melanocyl tablets, we observe that the patients unless and until they take the melanocyl tablets, there is a pigmentation and that is a somewhat darker than the normal skin color. So we don't observe this picture in our therapy. We observe that the patient got the very accurate skin color as per their original skin in these patients, and we doesn't observe any recurrence in my other patients also and during this trial also. So no recurrence after the stoppage of the treatment noted even after the 1 year or more in completely cured patients. In others, progress remains stationary, but the disease doesn't get worsened. So treatment is effective in all types of and in all ages and all sexes. So most important factor noted is a sudden trigger or the sudden upsurge of the pigmentation after the procedure. That means if consider that we are giving the regular OPD treatment, and if we do the panchakarmas or the purification treatment in these patients, our OPD result gets accentuated. So that is very important, and speed increases more times. So we got the very good typical pigmentation. I will show in slides. So trial therapy, this is the conclusion. So trial therapy, that is a therapeutic progression, has a statistically highly significant results in vitiligo patients. So most important factor noted is the trigger or sudden upsurge of the repigmentation after the procedure. So that is important. The results of the regular treatment and local treatment are specially aggravated after the procedure. So this is important. It also in good way, it also reduces the recurrence rate, and genetic transformation may have we can reduce the genetic transformation to the next generation with the use of the panchakarmas. So this has to be tested. Some patients may need repeated panchakarma procedure. In Ayurveda, it has been already advised some patients will require repeat panchakarma after the some that is a stability. So results from the present study needs to be verified by taking larger sample size. There is also need to do some laboratory research like the estimation of the MSH. I didn't find any laboratory doing the melanocyte stimulating hormone estimation and the other related hormones. We got the thyroid testings, but MSH is not generally tested in India. So other related hormones in the blood before and after the virechana. So these are the some slides, that is the before and after treatment and panchakarma procedures. So these are the very important slides. Complete cure of the disease. We look in these patients. So second patient, this is old age patient at the age of 60, 63. So we got this result. So this is a prior result and this is a post-treatment result. Significant pigmentation, and you look at the skin color. Skin color is perfect matching with her original skin. So this is a old age picture. Upper picture is old age picture. So this is a man aged more than 70 years, and he has got very good result with very soft panchakarma, not very forceful panchakarma. Okay, so generally these people have tendency for the constipation, so we will use the mild virechana or the purgation drugs in these patients. That is a lower picture is that is a young girl, so that she has also has the very good results. This boy again has the very good results. You see the pigmentation or the spots that come after the panchakarma. Generally 21st day to 1.5 months after the panchakarma or the purification process, we get these types of spottings there. So look at this. This is the original picture. So this guy has the some fungal infections for that also, because generally due to inflammation and getting wetted, fungus generally affects the area. So we have to protect that with the antifungal drugs and other treatments. Okay, so look at the serial changes. So this is a basic basic picture, first figure. Then we got the very good result with the first virechana, and in this patient we have done the 2 virechanas. Then we got the almost normal skin there. So skin is getting united, and some that is some 1 or 2% skin is remaining there. So this is ongoing treatment. So this is a before and after treatments pictures. Again has various levels. See at the skin developing, the developed nature of the skin of the developed skin. So exact the normal skin or more better than or the fresh than the normal skin we can develop. So this is a complete cure of the patient, young patient. Look at this. So this is a forehead. We can look at it total that is disappearance of the vitiligo lesions in these patients. In the legs, we can see this is a deeper vitiligo. So you can see the after treatment skin here. So there is a very much fresh skin development there. So this is a permanent result. So I have seen these patients. I am doing this practice for last 20 to 22 years. So I haven't seen any recurrence in any of my patients. Panchakarma, other procedures like Vaman, Basti are also more or less helpful in these patients. So this is my hospital. So I thanks all for silent hearing. So I will happy to have any questions from the learned audience here. So I request all to learn about the Ayurveda. I request all to learn the Ayurvedic principles. It is a harmless system. It is a without any side effect system, and it gets the root cause treatment. So we get in skin especially, I got very good enthusiastic results from the Ayurveda treatment, and that is without any side effects. So that's more important. Thank you to organizers for giving me opportunity and sharing my views.